Varicose veins are the most commonest condition which is seen in clinical practice nowadays. So, to define this medically, varicose veins are nothing but the swollen veins in the legs and the thigh region, or in around the ankle region. What we call it as swollen bluish veins, which is often tortuous in nature. So, normally these varicose veins will occur in the individuals who has more weight, say like obesity. If the individual has heavy weight, then it might leads to the impaired circulation of the venous system, and again it leads to the swelling of the veins. So, obesity is one of the most commonest risk factor for developing varicose veins at the earlier age. So, other risk factor will be the aging. So, normally when the age goes up, say like 40, after 45 years, normally the veins valves become weaker, and even the elastic fibers in the veins will become will reduce, and thereby the veins become weak, and the blood will start developing to stagnant over that particular place, which leads to the swelling of the veins. So, mainly aging and obesity are the most commonest risk factor, and the third risk factor will be the occupational factor. So, normally people who works longer time, who stand long time, or who lift heavy weights continuously, they are having the chance of developing varicose veins will be much higher. And even the people who develop varicose veins, which it will depend on the occupation which they follow, even they does. Normally specific occupation which we generally advise, generally seen in factory workers or hair stylists, or even the people who stands for long time, say like teachers, conductors, even garment workers. In this population we see this varicose veins commonly. And the most common other risk factors what we seen is even history of any trauma to the leg or ankle joint, which might lead to the varicose veins, or history of any surgeries happened before, or most common reason will be the strong hereditary factors. Suppose if anybody in the family has this varicose veins problem, father, mother or siblings, then the chance of developing varicose veins will be more higher. And normally this varicose veins we have seen more in the females, and especially females of childbearing age, normally between 25 to 35 years. And even during pregnancy, the risk of developing the varicose veins will be much higher, because of increasing the body weight and increasing body fluids in the venous circulation, which ultimately leads to the swelling of the veins. So, this varicose veins normally will occur in people who are very much sedentary, who has lack of physical activity, and even certain other risk factors also depending on their occupation, they will develop this varicose veins problem at the very younger age. And even the coming back to the symptoms, the most common symptom which we encounter is the pain, severe cramping pain in the legs, especially calf muscles pain, which usually develops at the night times, and even while taking rest the pain aggravates, and even the patient unable to sit for longer time, or he cannot walk for long time, or even he cannot climb, he find severe pain while climbing, or even the pain will be very much severe, especially in the early morning time. And many patients even develop swelling in the both legs, and even with the superficial skin turns bluish in color, and even some patient develops numbness in the legs without even they don't sense the pain. And even when the blood circulation is hampered, automatically the patient start developing all kinds of symptoms. Most commonest and early symptom will be the swollen legs, what we say. And even the main reason for this condition will be impaired venous circulation, especially when the valves become weaker. When the valvular leaflets will become weaker with the advancing age, automatically the blood circulation will be impaired. Normally in the veins the blood is pumped against the gravity. So, when the valves become weaker, blood start accumulating or becoming stagnant in the particular place, and it leads to the swollen condition, and thereby patients start experiencing the pain and swelling in the legs or even in the thigh region, and especially most of the patients find it difficult to walk for a prolonged time, and they even find it difficulty to carry out their daily activities routinely. So normally in varicose veins there are two varieties what we see. If it happens in the superficial veins, it is an alarming sign. Especially what happens in superficial veins, the veins will look like a spider web, and even it is bluish in color. When it occurs in the deeper veins or larger veins, then the patient start developing severe pain inside the thigh muscles or even in the calf muscles, and thereby the pains will be prolonged. Most of the conditions it will be the intermittent pain. Only pain occurs while doing strenuous activities or while continuous walking, or even after at the end of the day after prolonged straining, a patient will experience severe pain. So normally varicose veins in homeopathy there are very good medications, especially we treat at the root cause of any disease. Say like in varicose veins also we identify the factors which vein is damaged, to how far extent the valves are weaker or how far extent the vein has become weaker. Looking at that condition, we will give the medicines accordingly. We will strengthen the valves of the veins and even the elastic fibers which is there in the veins. When it is strengthened, automatically the blood circulation will be improved gradually, thereby the pain, the swelling, everything will subside gradually. And normally the complications of the veins, varicose veins will be mainly what we have seen is most commonly will be the a wound might develop in the particular region which might lead to varicose ulcer, and even the superficial skin above the particular place will become bluish in color, and even eczema might develop. That is so eczema is one of the most common complication. Even in certain individuals, blood clot might form and it might lead to pulmonary embolism, or even heart failure also chances will be there. Even in certain conditions, blood vessels will get infected. That condition we call it as thrombophlebitis. So there are plenty of complications arising out of this varicose veins. So whenever any patient develops any swelling in the legs or any pain persistently for 3 months, so definitely it's better not to neglect and to undergo particular scanning, especially Doppler venography. So it will be identified at what stage the condition is persisting, and even what the better medications and what the better management to be followed will be identified. So varicose veins, we have good medicines in homeopathic system. Normally we give some specific medicines to improve the swollen veins, or even to improve the blood circulation, and even to improve the valvular weakness, whatever. Normally it develops in the people who have this valvular incompetence, or when the blood circulation is very weak, the chance of developing varicose veins will be much higher than the individuals who don't have any positive family history. Normally the precautionary measures for the varicose veins includes avoiding sitting for longer time, or standing for prolonged time, or avoiding lifting heavy weights, or doing continuous strenuous activities, or even if doing such activities, it's better to use the stockings regularly, periodically, say like at least 3 to 4 hours a day, or even lie down with the foot elevated. These are all the things which definitely helps in preventing the complications. And even in certain individuals, if the body weight is very much higher, they have to take dietary supplements to reduce weight, or to maintain the dietary measures, especially rich in fiber food, or even raw vegetables, sprouts, green leafy vegetables definitely will help them to reduce the body weight, and thereby it will boost, or it will improve the blood circulation, and which ultimately leads to the improving varicose veins condition. And normally in homeopathic system we treat at the root level, and when the veins is strengthened at the root level, so the tendency of developing the disease again will be very much lesser, and even the complications will not develop in the near future. So for the permanent solution, homeopathic medicines are the best and effective medicines will be available in the homeopathic system. And especially like chronic conditions like varicose veins, or even any other conditions, we have very good medicines, and even with better and positive results we have seen in such cases.